So just to be clear, heart attack is the thing you know about. It's the pain in your chest, your left arm, jaw, your back sometimes. You can be sweaty, grey, you feel anxious, extreme tiredness, nausea sometimes. So that's the heart attack. It's when you dial 911 and get into hospital as quickly as you can. Heart failure is something different, and this now manifests with breathlessness, with swollen ankles, again extreme tiredness, but feeling faint. But people say it's more like drowning, the feeling that you might get there. And one of the reasons for this is that this sort of continual damage that leads to heart failure from the body is because when we were evolving, we didn't really get heart attacks. We had a very healthy diet. We were running about, being chased by saber-toothed tigers. We were hunting and gathering, and etc. And so we died earlier. The main threat wasn't heart attacks, but injury. And so you're either running from a predator or you've been injured. This is a cave painting of a man being attacked by a bison. So what the heart is responding to there, it's the fight or flight response, it's the exercise response trying to get you to run away, or it's the injury. It's a sense thinking you're having blood loss. You've got a cut, a wound, and you're losing blood. And so what it's trying to do is to conserve water and to stimulate your heart. So basically, it's a response, an ancient evolutionary response, similar to exercise and hemorrhage. And that's fine in an emergency. It's fine. But it's because it doesn't matter if your heart gets a little bit damaged. You've got to run away from the saber-toothed tiger. It's when these emergency responses go on for a long time, and they go on in heart failure for months, for years, that's when they become damaging. And so most of the drugs, in fact, you take for heart failure are to stop your body doing worse things to your heart, rather than anything else about reversing the damage. So what can you do to protect yourself about this? Well, understand the dangers, so you know a little bit more about when to be aware about getting heart disease and what you might be expecting to feel. So stop smoking, exercise. So I think the recommendation is something like 30 minutes of moderate exercise 5 days a week, 150 a week. And so I mean, I have to say, I'm not a role model. I don't do all of these things. So, I'm not your example, but I do exercise. I would an exercise bicycle for 15 minutes, and I would lift some weights. And then I would like to take walks in the park, Hyde Park, in fact. That's a nice way to do that. Keep a healthy weight. I'm passing over this one very quickly. Have your blood pressure tested. Now, blood pressure goes up, and with our lifestyle, it does go up. And I think many in the UK anyway, you get tested quite regularly for blood pressure, particularly over 40, as you're tested for high blood lipids, etc. So have your blood pressure tested. Limit your alcohol. Don't go binge drinking, and take the tablets. I'm a pharmacologist by trade, and so that means I like to design drugs, and I'm interested in drug mechanisms. And we've done a lot of hard work. We've really worked hard to get these tablets, so please take them. Blood pressure reduction. It's hard to reduce your blood pressure by lifestyle changes alone, and some people need 4 different kinds of drugs to do that, and even that might not do it. And so blood pressure is quite hard to get down. So do take the tablets. Same with statins. Now these reduce cholesterol, and they're very good. They reduce heart disease very well. But they've had a bit of a bad press because of side effects. But really, that's very much overestimated, and that's been proved. And so it's hard to get cholesterol down by eating healthily. These do this very effectively. So I hope that's been of some help. And I just want to move on now to ask whether you to think about these other things I've been asking. So one of the things I said was a problem was sudden and strong shock. And the question is, can you die of a broken heart? And I have to give talks on this quite a lot. And the broken heart syndrome, I call it a sex, drugs, and rock and roll talk, because yes, certainly bereavement is one of the biggest triggers for this. And so there's things like Carrie Fisher died, and then her mother, Debbie Reynolds, died very soon after. There was a shooting recently, a mass shooting, and the father died just after the child was killed. So all these tragic circumstances, definitely a trigger. But then other odd things as well, like energy drinks, or just being found out cheating, or dancing too much or something, or even weird things like a surprise birthday party. I mean, of course, you might think that's still an emotional shock there. And there's, you see this name here, it's sometimes called Takotsubo cardiomyopathy. But what I want to tell you is that there are two diseases really that are called broken heart syndrome. One is this Takotsubo cardiomyopathy, and this is where 80 to 90% of people who get this are postmenopausal females. And the other is sudden cardiac death, where people just have these arrhythmias and drop dead, and 90% of that, 80 to 90% of that is in males. They come under the same circumstances: bereavement, arguments, natural disasters, and young women don't seem to get either of these things. And there's one fantastic study, really very illustrative, where football, I have to say, football is a very strong trigger, especially a penalty shootout. And here, this is a Chilean family who are watching a penalty shootout in a cup final with Brazil, their enemies in terms of football. They lost. The family had a big argument, and then the husband got chest pains and was rushed into hospital, and his heart was in this fibrillation, so it wasn't beating, it couldn't beat at all, and had to be, they tried to defibrillate him, but they couldn't, so very sadly he died. And then his wife was brought in about an hour later, and she had very similar symptoms, but she had this Takotsubo cardiomyopathy, and so they found that her heart was okay, and she recovered, and was able to go home really quite soon afterwards. And so this stress cardiomyopathy, this is Takotsubo cardiomyopathy. Women come in with thinking they have a heart attack, but when they're imaged, there's no blockage of the vessel. But what they have is this very weird contraction of the heart here. And it looks like a balloon, so you get a lot of contraction at the top, but the rest of the heart's hardly contracting at all. It's almost paralyzed. And the Japanese doctors, who were the first people to see this, thought it looked like an octopus pot, where they trap octopuses, and that's a Takotsubo. And that's why it's called that. And so it takes a long time for me to explain this every time. So these, they don't get treated for heart attacks. So they're just supported. And then in about 5% of them, it is not completely benign. 5% of people who have this do die. But about 95% will recover in days to weeks. And about 3 to 5% of the patients who come in with heart attack symptoms, in fact, have this stress cardiomyopathy. So it's rare compared to the heart attack, but not unknown at all. And so what we know about this is that it's caused by adrenaline. It's just like physical exertion, which can have the same effect. Then some other conditions cause it too: asthma, where the drugs are very like adrenaline, the salmeterol that you get in your inhaler, or brain hemorrhage, where you get this sort of damage to the brain and you get an adrenaline release, and even something like an EpiPen, which is just one dose stop you having anaphylactic shock. This is adrenaline, and this can itself cause Takotsubo syndrome. So at first, what we think is that the heart is very strongly stimulated by adrenaline, which is what we know. Adrenaline stimulates the heart. But then there's a switch, and we've shown this in the laboratory, where it switches to a cardiodepressant phase. And although this shuts the part of the heart down, we think what it's trying to do is to protect it from the arrhythmias, from the fibrillation that you get. So what happens is this is adrenaline increasing. This is your heart function in the normal range, and so adrenaline stimulates it. Then when you get to high stress, you can get these arrhythmias. But if you have protection by the Takotsubo mechanism, then it shuts the heart down, but to prevent something even worse. In fact, what we found was, when we did the experiments, that when we did this and we had an anesthetized rat, and we gave it adrenaline, then we could see this Takotsubo syndrome. And so we knew what it was by then, and we knew what the pathways were. We thought we'll try and stop this. So we tried to block Takotsubo, but as soon as we blocked it, then it got brought on this arrhythmia and some sudden cardiac death. So we think this is kind of the least worst thing, and this is actually trying to protect the women from this this heart disease. So now, just to finish off, I'm going to switch to some of the very new science of the heart, and how we're going to mend this. We know that we can't. We have very little repair in the heart, and we're trying to think of a way that we can give back. What we really need is more muscle. None of the drugs we're using are giving it any more muscle, or even stimulating the heart, actually. They're just stopping the heart getting worse. So we're trying to get new muscle back into the heart. And of course, you've all heard about stem cells, I'm sure, because they're the new big thing. And a stem cell is a cell that hasn't really decided what to be yet. It's not anything, it's undifferentiated, but it can go and it can reproduce itself very much, very readily, and it can produce large numbers of cells. And then when it and this is usually in the embryo, and then when it encounters the different hormonal stimuluses, it can change into liver or blood or nerves or heart. And so it can produce, these stem cells can produce heart. In some tissues like hair, the liver, you have some adult stem cells that can do this kind of regeneration. But as we've seen in the heart, you really don't have very many. But there is another kind of cell which is more useful for us, and that's called the pluripotent stem cell. And this is the cell that you find in the embryo. In the embryo, when it's about 10 days after fertilization, a human embryo, so it's probably not even implanted in the womb yet. There's a little group of cells that if you take them out, they will carry on growing and growing and growing and growing. And then you can treat them with different hormones, and they will change into any cell type in the body, except the placenta. Any cell type, and they will very reproducibly make cardiomyocytes. Now, of course, that's interesting scientifically, but people didn't like the idea of destroying embryos. Most of these that were going to be used were ones that were going to be destroyed anyway after IVF. They've been taken for IVF. But nevertheless, you were destroying something that might have had a chance to grow up and to be a baby. So it's a guy called Shinya Yamanaka, about just over 10 years ago, won the Nobel Prize because he found a way to make stem cells like this out of ordinary cells in your body. So skin cells, for example, that was the first thing he used. And so you take a very small patch of skin and you can grow it up in the dish, and the skin cells, which are called fibroblasts in many cases, grow and they fill up the dish, and then you can treat them with factors that are present in the embryo that make the stem cells like they are. And so the science showed you what factors to use. And this now takes your skin cell back to sort of factory settings. It takes it back to an uncommitted cell. And so then, once you've got it in this state, you can again make these into cardiomyocytes, and in all the same things that you had to do for embryonic stem cells, you have to do for this, and it works extremely well, in fact. So this is something we made in the lab, and you can see this nice dish of cells contracting away. It's very useful. As a scientist, you don't have to do any complicated experiments to find out whether they're heart cells or not. You look down the microscope and there they are beating away. So there are those, and you can then make them, so now you have stem cells made into cardiomyocytes, and they can make the vascular cells as well. They can make the endothelial cells or fibroblasts or whatever. And so you now have these cells, and these are great for patient-specific repair. So they're immune matched to you. So if you put them back into your body, they wouldn't, theoretically at least, wouldn't be rejected. If you have a heart transplant, that comes from somebody else, and so you need immune suppression for your whole life, and that's not particularly great to take. It gives you infections and all sorts of things. But this is just your muscle. Just also an interesting thing first, because it's your muscle, if you have a mutation in your heart, then in the dish, your cells will have the mutation too. And you can see these effects of these mutations when you look down the microscope at these cells. So here we took some skin from patients with this particular mutation. You don't need to worry about that, but it gave a heart disease, a swelling of the heart. And what used to happen to these patients is that they would die of rhythm changes, arrhythmias in the heart. So we took some skin from a father who did have this disease, a son who had the disease, and another son who didn't have the disease. And we made the iPS cells from these different patients. And here they are now, and we've made them into strips of tissue. It's about 1 centimeter long. They're beating away. They've got on bendy posts. And you can see this one is beating quite rhythmically. Very nice. That's the same rate as your heart. Here is one of the carriers. This is a mild arrhythmia. So you have to look at this quite hard. And every now and again, if you look at it and you stare at it for a while, every now and again, it'll give a little skip. The beat will give a little skip and do a double beat. And that's quite a mild kind of change to the heart. But this one here, you can see if you look at it, it's just writhing, it's just wriggling. And this is the very severe arrhythmia that would kill these patients. So this shows the mutation, and we could use genetic engineering to engineer out the mutation and show that went away, or to put the mutation in here and show that the normal subject would have that same kind of arrhythmia. This is very useful to understand what's happening to your heart. And so you can then try out drugs, and this has been done. You can try out all sorts of drugs and see what might be best for the patient. And this has been done, and they've been given back to the patient, and it's worked. And so you can screen drugs. You can even do a clinical trial in a dish by getting patient samples from many, many patients and trying many, many drugs on them. And so this has speeded up all that kind of research on drug screening very, very well. But of course, what we really want to do is give back this tissue to the patient. So here is a patch we made. This is about the size of an elastoplast band-aid, the size of your thumb. And we were able to put this on a rabbit heart, and that worked extremely well. So we put it on as kind of as a patch here. And so they've got the cells on the inside near to the damaged part of the heart. And so this has been done on small animal models, and then on larger ones like pigs to make sure it's fit for use in humans. And this is the sort of patches. These are the first ones we started to use of the engineered heart tissue. It's called engineered heart tissue. And now we have the ones that I just showed you, a bit like your thumb. And here is one, here it is beating away, where you've got about 500 million cells in there. And it's now ready. It's about the size of the palm of your hand. And that would be just ideal size to put over the heart, the scar of a heart. And in fact, this happened. So there's this one that was in 2018 with the embryonic stem cell ones, and then the IPS ones have been used in China, Japan. This is the institute of the guy who made the IPS in the first place. And just recently, in the last month, there's been a report about these trials, and it's hopeful. They're very small numbers of patients, obviously, but they seem to be safe. They seem to be having some kind of good effect. So this is very, very early stages yet, but it's we can certainly make this heart tissue, and it certainly is in the right sort of it's the right sort of patch for this kind of disease. So I'm going to